Congress is back from their break this week, and their work resumes on the budget. What cuts are they looking at making to our healthcare and why? Welcome to Care Talk, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your questions at 202 838 6837, and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get next week's show. In today's episode, Bobby Kogan from Center for American Progress has some answers about the budget Congress is working on and how budget reconciliation will affect your health care. Welcome, Bobby.
Hey, Laura, thanks so much for having me back on.
There was supposed to be a budget released this week from the US House that was going to go into how they plan to cut nearly $1 trillion from our healthcare, from Medicaid. But that didn't happen. Can you tell us what is happening?
Yeah. So last week there was reporting that we would have text for the Energy and Commerce Committee, which oversees Medicaid and parts of Medicare, much of Medicare. And then Trump met with the Energy and Commerce team, and then it was reported that it was maybe happening next week, maybe later. So it's all TBD. But the short answer is that congressional Republicans are looking to severely cut Medicaid. And when I say severely cut, I mean they are looking at what will be the largest Medicaid cuts in all of U.S. history. It could be as large as $880 billion. They might be looking at only $500 billion, but that would still be the largest Medicaid cuts of all time in U.S. history. So the details are still being hammered out. That's the text that we're waiting on, but kind of everyone agrees that we're looking at enormous Medicaid cuts that would kick somewhere between 5 and 20 million people off of their health insurance, and probably bankrupt a lot of hospitals.
Let's talk more about that since people may not be aware that Medicaid actually covers more Americans than Medicare, which is a program that people tend to be a little bit more familiar with. Medicaid is called different things in different states, like Badger Care in Wisconsin. So many people whose health care is at risk, they may not even know, right?
Yeah, that's right. And we actually saw a similar thing with the ACA, right? Where they said, I hate Obamacare and I love Connect. Um, I love my exchanges that I get in Kentucky. That was the Connect, the KY, but I hate Obamacare, and it's the same sort of thing, right? So Medicaid covers, should have the number off the top of my head, but around 80 million people, and it has folks with long-term disabilities. It has many elderly folks. It has a lot of children on it. It has folks kind of that range from extremely poor to pretty poor. And actually some people who are kind of make even a little bit more than that. It is kind of one of the one of the lifelines for a lot of Americans, and making sure that fewer people fall through the cracks than already do, and that's what's at stake. What they're looking at doing, it's a shared program. The federal government pays for some of it, the states pay for some of it, and what they're looking at doing is giving less money to the states to run the program. And by pushing costs onto the states, that means that states will drop people. In some states, they have automatic provisions in their laws or their constitutions, where if the federal government pulls back money, they will automatically cut off some people. So it's going to kick off people. They're going to take away a lot of benefits in response, and the American people will be worse off.
hmm And let's talk a little bit about the various ways in which they could cut Medicaid. Since we don't have the bill yet, we don't know how they're planning to cut nearly $1 trillion from the program. One of the things that's been talked about are Medicaid job loss penalties, that if somebody loses their job, they would have these requirements that would then be forced to lose their Medicaid.
Yeah, so uh, they're looking at kind of instituting a lot of red tape to make it so that you have to do a lot of reporting around your job. So one, it means that if anything goes wrong with kind of any of the reporting things, then Even if you're kind of playing by the rules that they've set up, a lot of people will be kicked off. This is kind of what Georgia did, and it ended up disenrolling not just their target people that they were trying to disenroll, but a whole bunch of people who were kind of following the system correctly, because it was how much red tape was instituted. But to your point, it also ends up meaning that a whole bunch of people, if for anything, we enter a recession and you lose your job, that's it, you're out your Medicaid. You get so sick that you have to, you go beyond FMLA and whatever, you end up getting in trouble. That's it, you lose your Medicaid, right? And so it ends up having these really bad systems where then you can get trapped being sick for forever. Then you're too sick to afford healthcare, and you're too poor to afford healthcare, and then you're too sick to get a job, and now all of a sudden you're kind of trapped for forever in this state. So it's profoundly unfair to kind of to the people who would then be trapped in this cycle.
Yeah, because I think people may not be aware that some people will say, as they're proposing these drastic cuts, that it's okay, we'll make sure that people with disabilities are exempted. But that is not a simple process. You can be disabled and not have access to disability because you haven't met all of the paperwork and the requirements to be officially determined to be disabled by Social Security and other government programs. So I think some people that want to cut these programs are going to say there will be exemptions for people who they think might need it. But in practice, as you said, like in Georgia and also in Arkansas, in practice, all of these exemptions just wind up meaning that people who need their health care are going to be kicked off because they can't get the right form at the right time in the right place in the right way. That all of these paperwork requirements are going to mean people without health care that need it.
Yeah, that's right. And the disability one, as you say, is actually extra difficult. Disability determinations are very complicated and often take a long time. There's huge backlogs for Social Security disability insurance, just because it's such a complicated process. And Medicaid is supposed to be responsive, right? I mean, it's supposed to be if you, it's the income determinations are in many cases by month. And so the idea is, if I lose all my income and I lose my job, if I lost my job and I lost all my income, I don't want to have to wait a year and a half before I'm able to get health care again. That can be a death sentence for a lot of people. And so we want it to be flexible and responsive. And the more red tape you put in, the more you're actually keeping out people who you're trying to help. So it's something that in the name of trying to make sure you're hitting the people that you're only the people you're trying to hit, you actually are keeping out a lot of the people that you are actually trying to protect. Even if you disagree on how many people you should be protecting or that sort of stuff, it nonetheless kind of hits your unintended populations all the time. And we've seen that again and again with the states that have implemented measures like these.
Mm-hmm. And also, I think it's important to think about that people's circumstances change. And as you pointed out, if you have a job and you lose that job, if you get sick and lose the job, that you're not going to. It's when you need your health insurance the most. That just cutting up people's insurance cards doesn't save money. What saves money is taking away healthcare that people are using. And people aren't using healthcare for fun. They're using healthcare because they are sick, they have an injury, they need healthcare. The only way that they're going to save millions upon millions of dollars is by taking away care from people that need and are using it today.
Yeah, that's precisely right. If 0% of people who are on Medicaid use it, then it costs $0. It's not like the ACA premium tax credits where you're paying the premiums to the insurer whether or not the person actually goes to the doctor. Medicaid, the costs come from usage, and so any savings definitionally means taking healthcare away from people that are honest to God using their healthcare and need it.
So let's talk a little bit about the Senate side because the House, they passed the budget blueprint. The instructions are to cut nearly $1 trillion. And the committee that it's coming from, the vast majority of that is Medicaid. But on the Senate side, their budget blueprint could actually allow them to expand healthcare if they wanted to, right?
Yeah, it's funny. So yeah, that's right. So on the House side, they have the Energy and Commerce Committee, which is where Medicaid lives, and they're instructed to find $880 billion of cuts. But on the Senate side, Medicaid lives in a committee called the Finance Committee, which is also where all the taxes live. And because Republicans want to increase the deficit by doing tax cuts, they have given that committee an instruction to increase the deficit by 1.5 trillion, by no more than 1.5 trillion. So if they wanted to, Senate Republicans could walk out of there with a Medicaid expansion bill. You could expand it. I don't have the numbers off the top of my head, but you could imagine that you were expanding it from 138% of the poverty line to 150% of the poverty line, or 200% of the poverty line. You go not just people who are ludicrously poor, but also people who are extremely poor. You could cover right there, right? So you could take something. Medicare is also there. You could expand Medicare to cover, dental, hearing, and vision, kind of major oversights in care, right? So they actually have the ability to expand healthcare if they want to. Currently, they are planning to use that flexibility on tax cuts, but if they wanted to, they could do it on something that is actually directly helping people be healthy.
So this is really about choices. On the House side, they must cut, but on the Senate side, they could choose to expand healthcare. But instead, right now, what they're choosing to do is work towards more tax cuts for people like Elon Musk.
Yeah, that's right. I mean, not not to put too fine a point on it, but the tax bill that they're all looking at would give people in the top 0.1%, people making at least $3 to $5 million a year, give them $250,000 tax cut. And for the average household, you get about $1,000 tax cut. Um, so these are tax cuts that are drastically drastically tilted towards the rich, and then they're being offset partially, right? The part of the way that they're paying for these tax cuts for the rich is through these Medicaid cuts, right? And through these food assistance cuts. It's by taking healthcare away from people who are using it and taking food assistance away from people who are using it. It's the same sort of thing. It's only people who are actually honestly using this nutrition assistance. They don't have to do that. The House has an instruction that kind of pushes them that way, but one of the fun procedural rules is that the House can actually ignore its instructions. It's already ignoring some of its instructions, so they could walk out of there with something that doesn't cut Medicaid if they really wanted to. And the Senate's instructions, which actually are binding, don't force them to cut Medicaid either. But therefore, we will see. I mean, it will reflect kind of what they actually want to do. They are proposing, as I say, the largest Medicaid cuts in US history. They're proposing the largest nutrition assistance cuts in US history. And they're proposing to do that all as a way to partially offset tax cuts that disproportionately go to the rich. And we hope that they will have a change of heart. We hope that instead they'll walk out of there with something that helps struggling Americans instead of making their lives worse.
So let's talk one final thing about timeline. So we were supposed to see a House bill this week, but that sounds like it'll be next week or later. When are we going to see something on the Senate side, and when are they actually going to be voting on things?
Yeah, so the Senate cannot begin until the House is completely done. Um, you will remember well the House fight in the ACA repeal fight in 2017. They did the failed vote in March of 2017, and they just were at a standstill until they finally passed that in May. And then the Senate kind of began its process. It's the same thing over here. Because this bill has a tax component, it has to begin in the House of Representatives. And because it's a reconciliation bill, it needs to do a reconciliation bill that begins in the House of Representatives. So the Senate can't even begin on a shell bill or anything. So however long the House takes, whether we see text next week or the week after, there was one report that said maybe not until June, TBD. Then after all the committees are done, it'll go to the Budget Committee and then the Rules Committee and then the full floor. And then if they're able to pass it, it goes over to the Senate. At that point, it'll take at minimum a couple weeks. They have to do what's called the bird bath. And that's where they scrub the language provision by provision, line by line, provision by provision, clause by clause for things that are not in compliance with the Senate rules. What's special about this bill is it can avoid a filibuster. So normally nothing happens in Congress because you can't find 60 votes in Senate, 60 Senate votes to do anything controversial. But this thing can go through with only 51 votes as long as it follows a set of rules. So the Senate Budget Committee, Democrats and Republicans, and the various committees are going to go through every single line, and they're going to talk to the parliamentarian about and make arguments before her about whether they are in compliance with the rules or out of compliance with the rules. And that'll take weeks. And then they, at the same time, they're going to be working on tweaking language and everything. And the Senate could go through the committee process, or it could go straight to the floor. At the point they're going straight to the floor, the whole thing could be done in a week, as long as they have the votes. What happened for ACA repeal was they didn't have the votes. So they kept on churning and churning and churning and churning. And they finally said, let's just go forward. Let's just do it because, whatever. But this is just to say, if Republicans figure out their politics, the whole thing could be done in a month. And if they don't figure out their politics, it could go on indefinitely.
Well, we will hopefully have you back when there's an actual bill to discuss. Right now, we're speculating based on what we've heard and what's out there in the media about what could be in this bill. We just know the top lines that they want to cut nearly $1 trillion on the House side. So thank you very much for joining us, and we will certainly have you back when we have a bill to talk about.
Thanks so much for having me on.
And now I'm going to Louise Norris of healthinsurance.org to talk about what's news from the Trump administration on your healthcare in the past week or so. Welcome, Louise.
Thank you, Laura. So this isn't from the Trump administration per se, but it pertains to marketplace health insurance. One new thing that had happened last week was Aetna CVS announced that they will exit the health insurance marketplaces at the end of 2025. So Aetna has plans in 17 states. They cover more than 1 million marketplace enrollees. So quite a few people impacted by this. Your coverage will stay in effect throughout 2025 as long as you continue to pay your premiums. But if you have an Aetna CVS marketplace plan this year, you are going to need to pick a new plan during open enrollment this fall. Aetna said that the marketplace plans were not profitable. But it's also important to note that the federal government has been doing things to make it more challenging for insurers in that space, such as not doing anything to extend the subsidy enhancements that are currently in place and scheduled to expire at the end of this year. So if those don't get extended by Congress, subsidies will decline for everyone next year, which CBO has said will result in about 4 million fewer people signing up for those plans. And of course, it's the healthier people who forego coverage when it becomes more expensive. And then also the proposed rule that HHS put out this spring mostly was aimed at doing things that will result in fewer people enrolling in marketplace coverage. So it does not surprise me to see a carrier, a significant large carrier exiting. We might see more. We will keep you posted on that throughout this spring, but just a heads up to people with Aetna marketplace plans to pay attention to any notifications you get this fall from your carrier, from the marketplace, and be ready to shop for a new plan.
Thanks, Louise. One of our questions from the Sarah with an H on Threads. My kid's air ambulance ride explanation of benefits came in from a not covered provider. The cost of care was $81,000. Insurance is still analyzing what they'll cover. If they don't cover it, we're ruined. I'm scared, and I'm also, just so grateful to have my child alive and reasonably well. So do you have some thoughts for Sarah?
Yes. So you mentioned that, first of all, I am also very glad that your kid is alive and recovering. But you did mention that insurance is still analyzing it. So this may all end up being taken care of from the insurance end of it. It should be. You should not get an out-of-network bill for air ambulance care, assuming you have real major medical health insurance, not something like a short-term plan or a fixed indemnity plan. Assuming it is real major medical coverage, there's been a federal rule in place for the last 3 years that prohibits out-of-network balance billing for air ambulance care. Unfortunately, it doesn't apply to ground ambulance, but air ambulance does tend to be much, much more expensive, and you are protected against that. If you do end up getting a bill, you can contact the air ambulance company and your health plan and say, why am I getting this bill? I should be protected under what's called the No Surprises Act. If you don't get any traction there, the federal government does have a No Surprises Act help desk. You can call them at 1-800-985-3059 and initiate a complaint, find out what you need to do. But the good news is you should be protected. They should cap your out-of-pocket costs at what it would have been if the air ambulance was in network.
Thank you, Louise. And now, welcome Diane Archer from Just Care and Social Security Works. And we're going to talk more about what if they succeed in cutting Medicaid. For example, what's going to happen to folks in nursing homes who rely on Medicaid to cover the cost? Where will they go? Diane?
It's such an important question. And as Bobby said earlier, we still don't know what's going to be cut and how it's going to be cut. But one thing everybody who wants to do something should know is that the federal government has been overpaying the Medicare Advantage plans to the tune of $1 trillion over the next 10 years, according to the Congressional Budget Office. And Republicans who want to cut money from the budget could easily take the money out of Medicare Advantage insurers without hurting people with Medicaid or people with Medicare. This is just extra money that shouldn't be paid, and it would be an easy way to solve the problem. So call your members of Congress if that's a solution you believe in. But let's move on actually to sort of all of the ways this could affect older people and people with Medicare who also have Medicaid in nursing homes. Many people don't realize that the federal government pays the largest chunk of the bill for people getting nursing home care and home care. And so even though Medicaid is a state-based program from the perspective of enrollment, it is federal dollars that are being used to pay for a big chunk of nursing home care, and that's our concern. And here I just want to flag that Medicare does not pay for long-term care. So if you have Medicare and you need to go into a nursing home, you are really out of luck unless you also have Medicaid, or it's something like $111,000 a year typically if you have to pay for it, which almost nobody obviously can afford. So that is the problem here, and that is what we do not want to have happen, is to have the federal government take away those precious dollars that go for nursing home care and home care.
So what happens if they actually do cut Medicaid money? What happens to somebody in a nursing home if they're paid for by Medicaid right now and Medicaid is cut?
Good question. So every state can handle it differently. But right now, what we understand is that Medicaid is covering about 63% of nursing home residents. So the vast majority of people in nursing homes are covered by Medicaid. And so they are all at significant risk. Each state, again, can do it differently. But the question is, what can they do if a ton of money is cut? And the concern is that they will just eliminate long-term care services as much as they possibly can. Another alternative would be to pay less for nursing home care, but already the government pays very little. And so staffing tends to be limited. If they pay less, there'll be even less staffing. And then we need to worry about quality of care and poor health outcomes for patients in nursing homes. The reality is that there are a lot of people in getting Medicaid coverage of their nursing home care and their home care under what's called an optional program, which means that they have a little more income than the poorest of the poor getting Medicaid, but they don't have anywhere near the money to be able to afford nursing home care. And those are the people who are most at risk of losing coverage. And that's hundreds of thousands of people across the country who could lose their nursing home coverage or their home care. I think the total number is something like 2 million who are getting Medicaid covered home care services or nursing home services. So it's a deep concern that many of them be left without any care at all.
And you mentioned before that the average cost of a nursing home stay for a year's worth is over $100,000.
Yes. For care in a semi-private room, I think the number is $111,000 now, or even higher. So that is just unaffordable. So what happens? Does the nursing home close? That's another possibility because it's not getting enough money, and then people are left in the streets. Where do they go? The states are going to have to make some really hard choices, and it's going to lead to a lot of deaths. It's going to lead to a lot of deaths and a lot of really premature deaths for a lot of older people.
Mm-hmm. Well, what if Congress repeals or delays the Medicaid enrollment and eligibility rule?
So that's another big concern. That's another way Congress can go, or an additional way. And that would mean that about 1 million people who are low income older adults could lose extra coverage. These are people who have Medicare as well as Medicaid, and the Medicaid picks up their Medicare premiums and their out-of-pocket costs. Well, those are significant. And if they don't have Medicaid to pick up those costs, there are a lot of people who won't be able to afford even Medicare. So Medicaid and Medicare are intertwined in ways that a lot of people don't fully appreciate. And a lot of people, again, with Medicare could be at risk if these cuts go into effect. And again, it will depend on how states decide to deal with the cuts, but there's no pretty way. There's no easy way. Some people are going to get hurt significantly.
And a final question from our viewer, Cynthia Jackson, who wants to know, how can we stop this from happening?
Well, again, yeah, there's only your ability to appeal to your members of Congress, contact your senators, contact your member of Congress, and explain why this is just a very dangerous thing to do that will hurt hundreds of thousands easily of older adults and people with disabilities relying on Medicaid for their health care. And that there is an alternative. And the alternative, if they have to cut, is to cut the overpayments in Medicare to the Medicare Advantage insurers.
Mm-hmm. So far, it doesn't sound like they're looking at that, but that is, they should hear from you that they should.
Actually, Laura, there are a few and an increasing number of Republicans who are talking about it. Not enough, but it's definitely broken through. And I think there is a growing recognition of the overpayments to the Medicare Advantage insurers that we would hope that Congress would focus on, at least in part, instead of doing outrageously high Medicaid cuts.
Mm-hmm. Yeah, because these insurers are gaming the system and taking advantage of American taxpayers for their own profit.
Yep, and eating into the Medicare Trust Fund and driving up Medicare premiums. So eliminating the overpayments would actually bring down costs for people with Medicare, as well as help all the people with Medicaid who are now at risk.
Thank you so much, Diane.
Thank you.
And thank you, everyone, for joining us today to learn more about federal budget and possible cuts to our healthcare. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America, and perhaps there will be a budget bill that we'll be talking about if it has been released. Please be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.